synthetic hormones and the bioidentical hormones because they are very different. The oral hormones, which many of you have heard of the oral contraceptives, like Premarin, is made from horse urine. It's synthetic, not like human estrogen. It's the same as horse estrogen. And Provera is the progesterone, which is the synthetic progesterone. Nothing like human progesterone. And the reason why this is important is because that it affects the way that the body senses it and receives it. Bioidentical hormones, on the other hand, these are hormones that are exactly the same chemical structure as the hormones in the human body. So they respond the same. They respond exactly the same as the hormones that we have in our body, as well as they attach to the receptors the same way. The reason why this is important is because when your body responds to it, it's going to see it as normal hormone. And the other thing that's really important about this is that bioidentical hormones can be tested in the blood as far as how much hormone we have in our blood. Whereas if anybody has known anybody or you've been on oral contraceptive yourself, your doctor never tests the blood. And the reason why is because you cannot test synthetic oral hormones in the blood because it's foreign to the body. So synthetic hormones are foreign, bioidentical hormones are the same chemical structure. And this tells us why we're going to see in the next few slides the research that shows which one is better for you. You must define the types of hormones that you have in the system. Estrogen that's synthetic oral estrogen is nothing like the bioidentical hormones that you have. It's like taking apples and oranges. Apples and oranges are both fruit, but they're very different. And the way your body responds to it is also going to be very different. So what many of you have heard is this landmark study that was done in 2002. It was the Women's Health Initiative. And in the Women's Health Initiative, what they found were a few very disturbing things about oral synthetic hormones. We're talking about Premarin, Prempro, and Provera. All of these hormones that were tested in the Women's Health Initiative in 2002 were discussing the oral synthetic hormones. And what they found are a few things. They increased the rate of stroke by 41%. They doubled the risk of blood clots. There was a 25% increase in heart disease. And there was a 37% increase in colon cancer. Now this doesn't make sense possibly to a lot of you because what I discussed earlier was that estrogen actually decreases the risk of heart disease. Yet when you are on synthetic oral estrogen, you actually have an increased risk of heart disease. And the reason is that oral Provera and Prempro and Premarin all are synthetic and are not natural to the body. And this is the reason why they don't have the same effects as the estrogen in our body. In 2009, there was a study done by a French researcher. And the reason why a lot of the research on bioidentical hormones were done in Europe is because Europeans have been using bioidentical hormones for a very long time. In America, it's only been getting popular since the early 90s. But the research has shown in Europe and now in the United States that bioidentical hormones are not only safe, but they decrease the risk of heart disease. There's no increased risk of breast cancer with bioidentical hormones, as well as they decrease the risk of cholesterol, increased cholesterol. In 2009, 80,000 women were in the study. So 80,000 women that were on bioidentical hormones were tested. And what they found, again, was there was no increased risk of breast cancer, they had lower risk of heart disease, they had lower blood pressures, and they also had a lower risk of increased body fat and diabetes. So estrogen compared oral estrogen versus bioidentical estrogen. When you look at the two, what you see is that the risk of blood clots with oral synthetic estrogens increase. With bioidentical hormones, they do not. Blood pressure with oral synthetic hormones increase. With bioidentical hormones, blood pressure actually decreases. The risk of developing gallstones greatly increases when women take oral synthetic hormones. When you take bioidentical hormones, there's no change. Weight gain, women who take oral synthetic hormones increase their risk of developing weight gain and belly fat. With bioidentical hormones, there is no increase in weight gain. Cholesterol, triglycerides, they all increase with oral synthetic hormones. Bioidentical hormones all decrease the risk of increased cholesterol. The next slide, we are going to look at progesterone. And we look at the difference between synthetic progestins and bioidentical progesterone. Blood pressure increases with synthetic hormone. Bioidentical hormones decreases blood pressure. With synthetic progesterone, cholesterol increases. Bioidentical hormones, it will decrease. Women who are on synthetic hormones, progesterone, have no protection against breast cancer, where if you take bioidentical hormones, you have an increased protection of breast cancer. Now, uterine cancer is protective with both synthetic and bioidentical hormones. So you have to say there's always something good in everything you do, but this is the only thing that synthetic hormones really has that's positive. Risk of heart disease. Your risk of heart disease goes up with synthetic hormones. It goes down with bioidentical hormones. Calming effects and insomnia are both positively affected with bioidentical hormones. The synthetic oral hormones do not have that effect. It's important to understand the type of hormone that you have. And estrogen actually has 3 types of estrogen. To make it simple, we're going to call them E1, estrone, E2, and E3. Now, E1 has the strongest link to breast cancer. E2 has the most positive effects as far as the effects on the body. And E3 has the strongest protective ability against breast cancer. So when you take synthetic estrogen, Premarin, horse estrogen, it's a combination of 50% E1 and 50% E2. So that means that you are putting half of the estrogen in your body is increasing your risk of developing breast cancer because it has the E1, which has the strongest link to it. When you take bioidentical hormones, we usually do a combination of 80% E3, which is protective of breast cancer, and 20% E2, which gives you the positive effects of estrogen. It's very important